Yeah, my thoughts on membrane sweeps are, if it's okay with you, it's okay with me. But let's first talk about what is a membrane sweep. I, of course, have my trusty uterus, which, of course, has a little peep window. Yours won't have a peep window. And then here is your cervix. I mean, you can see for this purpose, this cervix is pretty dilated, but yours might not be if you are considering a membrane sweep, because one of the purposes of a membrane sweep is to get labor moving. These are usually done at your prenatal appointments, very close to the end of your pregnancy during a cervical exam. To get a membrane sweep, your cervix actually has to be dilated enough for your provider to be able to get their fingers through your cervix, because what they're going to do is sweep their fingers all the way around your cervix in an attempt to separate this amniotic sac from the uterine wall. Because when they do that, there is a release of prostaglandin, which hopefully softens your cervix a bit and maybe thins it a bit to get it more ready for labor. You can imagine there are some risks to this procedure because your provider is putting their fingers into your cervix, and even when you wear a sterile glove, there is always a small risk of infection. The other risk of this procedure is during this separation of this amniotic sac from this uterine wall, you can actually have your membranes accidentally broken. And when your waters are broken, you're now on a clock. Full disclosure, you are probably going to find this procedure pretty painful. Now, is this a guarantee that you're going to go into labor? No! It seems to work the best if you're like almost in labor, sort of teetering on the edge, and it's just like a little nudge in the right direction. No matter how you feel about membrane sweeps, one thing we can all agree on is that your provider needs your informed consent before performing a membrane sweep.